Is everything okay, John?
Yeah.
Just get the intro thing. Hello, everyone, and welcome to CripChat, your weekly podcast on everything disability. So I'm with me, John, David, myself, and a very guest. We have with us Ross, Joyce. How's it going, Ross?
Good, thanks, Ibby. Good to be on.
All good, thank you, Joyce. So, Ross, before we get into our topic on the Disability Royal Commission, tell us a bit about yourself.
Yeah, look, I'm the Chief Executive Officer.
Sorry, Ross. Yep, go ahead.
I'm the Chief Executive Officer of the Australian Federation of Disability Organisations. We're a disabled people's organisation, and we represent nationally people with disability right across Australia. And we have a proud 40-member organisation group that is underpinning us. So our opinions count from not only those with specific disabilities, but also from the cross-disability area as well.
Cool. Interesting. Welcome, Ross. Welcome once again. So tell us more about the role they do at the Australian Federation Disability Organisation.
Yeah, sure. As I mentioned, we do systemic advocacy. That's advocacy and policy work. We work at a systems level, so we work predominantly with the federal government and federal government departments in looking at what they're doing in terms of policy. We may be putting in submissions. We may be providing advice on government initiatives that they want to put forward. And obviously we look at any policy or legislative changes that they may be wanting to do that are going to obviously impact in many, many ways on people with disabilities. So it cuts across the whole range of areas. We probably cover most of the government departments, but particularly we do a lot of work through the Department of Social Services. Obviously there's transport, there's education, there's health, etc.
Interesting. Thank you for that, Ross. So just an overview of the Commission's findings. Can you provide like a summary of the key findings of the Disability Royal Commission?
Yeah, sure. Look, there were quite a lot. There were 222 recommendations, and they covered a wide span of areas, which was good for us to see after 4.5 years of having the Royal Commission. So it was good to get into and look at, well, what are the commissioners actually recommending and saying out of all of that? Quite a number of them impacted on rights and legal rights of people with disability. And there were quite a number where there were differences between the commissioners. And there were 3 key areas in that regard. One was on supported employment, one was on education, and then one was on supported accommodation as well. So I think we got quite a range of outcomes from the Royal Commission. You would expect that because there were a lot of people that provided evidence and testified to the Royal Commission. We provided numerous submissions to the Royal Commission along with many of our colleagues across the sector. So it was good to actually see the 222 recommendations come out. And as you know, it was a long time in the making. You know, there was a push at least of 10 or more years to try and get a Royal Commission. So it was great that we could actually achieve that. I suppose having looked at where we've gone with the recommendations, the work is now in front of us, though, to make sure that we do get those recommendations implemented. And now I suppose that's the challenge in where we are today, is looking at, well, it's the Albanese government, the federal government, that's responsible for the Royal Commission in the end. They weren't in government when it came into operation, but they were certainly in government when it was reporting on that. So now we want to try and see where we're going with the outcomes from that Royal Commission.
Interesting you say that. Sorry, yeah, go ahead, John. Okay, sorry about that. Yeah, look, it's interesting, you know. Yeah, go ahead, John. Sorry.
So, what was your initial reaction when they get over the recommendations for adults?
Yeah.
Yeah, good question about
So,
how they
what was the initial
about.
reaction?
Sorry, Ibby.
No, go ahead. Sorry.
No, I was going to say a good question there was about how did the Commission gather and analyse the data to come up with all those findings? Well, as we said, it was over 4.5 years. There were thousands of testimonies provided to the Commission. The Commission undertook a wide range of hearings right around the country, which was good, which allowed people with disability, their families and others and organisations such as ours to be able to get in there and provide quality evidence and quality documentation that they could then gather and analyse, which they did do. They spent a lot of time analysing that. They produced a number of interim reports as well over that 4.5 years. We obviously had the interruption, as we all did with our lives, with COVID, interrupting the Commission's work. But in good news, the Commission was actually extended by the federal government for a longer period to allow for that. So there's been a lot of testimony and there's been a lot of people really, and got to thank the people with disability right across Australia for contributing in and doing what they could to make sure that their views were heard. And there are some really, really harrowing accounts that were put forward at the Commission, as we knew there would be. And I suppose the view that we had was, and still have, is the violence, abuse, neglect and exploitation of people with disability is not just an historical issue. It is currently happening right now. And we want to see the recommendations put into play that stop that. We want to stop it. And so now we're at the hard end, and that's where we had the government come out last week with its response to the recommendations.
Yeah. Yeah, no, thank you very much for sharing. We'll move on to our personal stories and the impacts. So, Ross, tell me the story of how the Commissioner's findings have impacted your life or the life of someone you know as a disability.
Well, I mentioned that we're a disabled people's organisation, so clearly, you know, the impacts of the impacts of just testifying at the Commission were very hard for a lot of people. Good news was there was supports provided to ensure that anyone testifying was supported. I certainly did some testimony as well. And obviously we did that based on our members' feedback, our member organisations' feedback. But, you know, I've got to say, really proud of the amount of people with disability and their families also that got forward and testified, because without shining a light on these issues for people with disability, the violence, the abuse, the neglect and the exploitation, the rest of the community who aren't involved wouldn't understand that. So I think from that point of view, it's been really good in being able to communicate those solid stories and the grief, the anguish, the hurt, and that's deep for a lot of people, and that still is happening, as I said. And so I think it was a great opportunity. And if you go back over some of the testimony, you know, seriously, you're just appalled and quite ashamed of the way things can be allowed to still run across Australia and still impact for people with disability and their families. But it's usually the person with disability that's copying it. It's the person with disability that's copying the violence, the abuse, exploitation, or neglect. And that's why we want to make sure that now we've had our Royal Commission, we've got the recommendations from our Royal Commission. We now all need to work really hard to make sure that we get the rest of the community up and listening still and paying attention to what needs to be done.
Yeah, that's true. That's true. Thank you for that, Ross. I think it's all about the individual with the lived experiences. They're the ones that are being impacted. So, yeah, I guess we need to work on how these commissions can work for us, people with disability. At the end of the day, thank you, Ross.
And
Ross,
is the work continues that the stories are not shared in vain, and that we capture the attention of the general public.
yes,
I think you're right,
yes,
Jonathan.
I agree, John. Yep.
We need to make sure that all of the testimony,
So our
all of
stories are
the things that
heard
people
and
with
shared.
disability have put forward isn't forgotten. Yeah, correct.
Spot on. Thank you for that, John. Ross, describe a time where the issues are highlighted by the Commission directly affected you.
Right, yeah, thanks, Ibby. I think quite a number of the stories were very harrowing. And as I said, it was incredible that quite a number of people with disability would go forward and tell those stories. And clearly it was not only distressing for them to, in some ways, relive what they'd been through, but really important for all of us to hear that as well and learn firsthand what the experiences have been and still are. I mentioned at the beginning, we're not talking just historical abuse, neglect, exploitation, and violence. We're talking about it still happening now. And, that's quite a shame for all of us, no matter where we are, to understand that. And I think those stories that came forward really highlight the deep issues that are still there and quite a range of areas where we need to address that. And it cuts right across community. It's not just one area. It's not just one place. It's not just in supported accommodation. It cuts right across the community of Australia, no matter where you are, whether you're in metro, whether you're in regional, whether you're in rural, whether you're in rural remote. It's happening and it's there. So I was quite impacted by a lot of the stories.
Yeah. Now, this is why it's important for individuals to advocate for themselves and for their community. Be the voice, be the leader. Create change for the better. So we'll move on to the recommendations and reactions. So Ross, how do you feel about the recommendations?
Well, like all of us across the
made by
sector,
the DRC?
Yeah, like all of us across the sector, I mean, we were fairly disappointed by the government's response. We made that pretty clear on the day, and in cross interviews, I did quite a number of interviews over the 2 days and beyond, and I still did some more even this week, just to highlight that, coming out, there's 222 recommendations. The government sort of said they've got direct responsibility for 84. They only came out and accepted 13 out of the 222 recommendations. There's quite a number that they said that They approve in principle or agree in principle. And then there are a number that were really disappointing that we saw where they only noted them as well. And I'll give you an example of one of those. One of those was recommendation 5.6 from the Royal Commission, and that was establishing a Department of Disability Equality and Inclusion, and the key one for us was appointing a new Minister for Disability Inclusion. That would be the first time when there would be an actual department that would be recognising and responsible for people with disability. And what did the government do on that one? It noted it. Well, not good enough. That's not leadership from what we believe. AFTO and our member organisations, we put forward earlier in the year what we thought would be some of the key recommendations that should be followed by the government and what we thought should be advanced and agreed to in 2024. We did that at the beginning of the year. We also did our report card on the Disability Royal Commission's 222 recommendations. We got that out in December last year. Then we waited 9 months for the government to come out with a response, and only 13 of those recommendations have been accepted, and there's about another 130 or something that they've said accept in principle. But accepting in principle doesn't mean that anything's going to happen. That's our problem with it. And then, as I said to you, they wanted to push quite a number of the recommendations to say, well, that's the responsibility of the state and territory governments. You know, they've got direct responsibility for 50 of those, and then there's joint responsibility between the federal government and the states and territory governments for 85 of those recommendations. Well, sorry, we want to see leadership from the federal government. It was a federal government Royal Commission. It wasn't a state and territory Royal Commission. Federal government should take up the leadership on that and ensure that we see positive action on the recommendations, and we don't care if they want to say it's a state and territory responsibility. You've got the leadership role. It's you as the federal government, not the state and territories. You're in charge. You've got to make it happen, and you've got to do the hard work to make it happen. So we were very disappointed with the fact that we had only 13 recommendations accepted. We had also, the other part is, no timelines put on when they'll be doing anything. Nothing. They've had 9 months to not only consider recommendations, let's even just look at the ones that are just federal government only, as they say. Well, where's your timeline on implementing that? Where's your timeline on advancing it? So look, you can hear we're really disappointed. We're pushing the government on this, and we want to see some leadership.
Yeah. Yeah. Well said. Well said.
And what's really required now is we grasp action to make sure history doesn't repeat itself.
Well, yeah, look, I think it's up to all of us. It's not just up to AFTO or the other sector representative organisations. Again, I think it gets back to all of us making a push with the federal government to say, well, not good enough. We want to see action. We want to see you moving things. And I think that they will respond to public pressure. And I think the thing in our favour for all of us is there is a federal election coming up. So now's a good opportunity to put some more pressure to get some quicker action happening on the recommendations.
Yep, and I couldn't agree more. We'll now go into implementation and future direction and what that's all about. So, Ross, how can the recommendations be effectively implemented to bring about real change?
Yeah, look, it's a good question. And as we said, there's a broad span of recommendations there. We'd like to see quite a number of those moved along. and we had published 10 points, and I mentioned one of them, which was about looking for the Department of Disability Equality and having a new Minister for Disability Inclusion in the government. That doesn't look like the federal government's going to action on that one. But I think there's quite a range of other areas where we can get some progress. But we do need to push for the timelines. That's what we're missing. So how can we effectively bring about the change? We need to put pressure back on the government. They got a fair bit of pressure over the last week on their response. We need to continue that pressure and ramp it up. And that's why I'm said, in response to Jonathan's comment, I think, it's up to all of us to continue to put that pressure. Contact your local member, federal local member, talk to them about it. Yeah. Contact your local state member of parliament or territory member of parliament. Put pressure on them to say, we want to see some action. We're not going to sit around for another 10 years waiting for things to happen. So that's what we have to do. We're going to do that. AFDO and all of our member organisations will be doing that. But what we need is the groundswell again. And we've seen it before. Once people with disability and their families and supporters get motivated, we can achieve a lot. We've proven that on a number of things in the last 5 years. This is another one where we need to really put the pressure back on. And I'd suggest to the listeners, get out there, get to speak with your federal parliamentarian, get to speak with your state or territory parliamentarian as well. Put the pressure on. Send a letter, send an email, do what you can, go to their office, make an appointment. Talk about the fact is that we're all wanting to see change happen. And there's quite a number of good things that we can do to press and push things along.
Yeah. Yeah. Interesting. Yeah. No, thank you very much for that, Alice. Now, we talk about, building on the disability advocate space. And for those that, advocate for people with disability, what role do you see them doing in ensuring the recommendations are followed through?
Yeah, well, clearly I mentioned that there's ground. We work in the systemic advocacy space, and then we've got a lot of people that work in the individual advocacy space, supporting people with disability to make sure that their rights are upheld. So again, I think as a collective, we can all do a lot more pressure on them. From our point of view, from systemic advocacy, we're back starting working strongly again to make sure that we get some leadership from the federal government, that we get some timelines on when they're going to be looking at putting these ones that they've agreed in principle, or what does that mean, and when are we going to see something there? And for the 13 that they've accepted, what's the timeline on that? When are we going to see some action on those? So again, we've got to keep the pressure up from the advocacy space to make sure that things don't just slide along and don't get gazumped because there's a federal election coming up, either, probably early in the new year. We don't want to see that stopping things. Traditionally, though, as you would probably know, when there's a federal election looming, government tends to slow down on what it's going to do with any of the reform stuff whilst it fights for its re-election. We still want to make sure we hold them accountable. We want them held accountable for the actions. We want them held accountable for producing timelines on when things are going to actually take place. That's what we haven't seen at this point. And I said earlier, disappointed after 9 months, they couldn't even do that on the recommendations that they say they're responsible for.
Yeah. Disappointing. You mentioned earlier about possible call to action that our listeners can do to support the implementation of the Commission's recommendations. Is there anything you want to add?
No, look, I think I made it fairly clear. I think the best form of pressure is to get motivated, get out there and say, we want to see more coming from our Royal Commission's recommendations, and we want to see action, and we want to see timelines, and we want to see it now. We don't want to hear that you're going to have a look at it, and that could be another 2, 3, 4, 5 years. Look, there are some big issues I'm not trying to make it sound easy. There are some really big issues in what the Disability Royal Commission came out with. We know particularly on the segregation area and inclusive education, on supported employment, and on supported accommodation. We know that there's big things that need to happen in that space. But if we don't get going on them, nothing's going to change. So there are some other areas where we can get some wins on it. We want to see revision of the Disability Discrimination Act. That's something that they could get going on now. It's an old act. We all know the problems that we have with that act. They could quite easily start working on that and moving it along as a simple one. Now, there's a lot of other ones where they could move on things as well and move quickly on them. The 13 recommendations.
I just
Sorry, Jonathan.
want to see momentum toward the disability rights act to give tangible outcome.
Yeah, well, the rights were pretty well reinforced through the recommendations from the Disability Royal Commission. And they came out with, as we know, they were suggesting that there's a Disability Rights Act, where we were supportive up until then. We were very supportive of the push by the Australian Human Rights Commission to have a Human Rights Act for Australia. We still are, but we're discussing that with our member organisations because the fact that we weren't probably as aware at that point how advanced that is in terms of getting that forward, whereas a Disability Rights Act is at the very beginning and would take a number of years to get to the same scope and point as to where the Australian Human Rights Act is at this stage. Now, we don't have either in, but I'd just say that from our perspective at the moment, we just had Disability Rights Commissioner Rosemary KS at our member forum this week, who was obviously quite strong about the need for a Australian Human Rights Act, because that would encompass everybody and it wouldn't just distinguish people with disability. It would encompass their rights, our rights, make sure that they're considered as part of a total inclusive society in terms of the Rights Act. So I think that's another big one that we would like to see moving along. And if we can't get the Australian Human Rights Act through, then clearly Disability Rights Act would be right on the top of the agenda for us to get through as well.
Yeah, no, thank you for that, Ross. I got David with you on the phone. David, did you want to ask a question?
Well, has it been implemented at all yet? Have any of the
Recommendations?
Recommendations been implemented yet?
No, David. None of the recommendations have been implemented yet. We waited 9 months for the federal government to tell us what their position was on the recommendations. They came out with that last Wednesday last week, and as I indicated earlier, the whole sector and people with disability were pretty disappointed at what we saw as a fairly lacklustre response, and one that didn't provide an adoption of most of the recommendations. There were only 13 that they agreed with. Now, having agreed with them, that's our problem, is we don't have a timeline on what they're going to do about that. That wasn't announced last week. So the 13 even that they've agreed on, there's no timeline on when they're putting them into operation. And then there's all the rest, the whole rest of the 222 recommendations, less the 13. There's no progress on those at this stage. So we're still waiting to see action. And that's I suppose, the disappointing part for all of us. We want to see some action. We want to see the timelines, and we want to know when.
So they want to include us, but they don't want to get our recommendations.
What do you mean by that?
Well, with the disability, if they ask us what is good for us and what they think we can help us, then work with us.
Yeah, couldn't agree more,
We'll meet
Dave.
you halfway.
Yeah, that's right. We're more than happy to work and continue working on it. But they also need to actually be putting forward some actions on what are they going to do, and that's what we want to work with them on. So,
but it sounds like they want to limit us.
Yeah, look, I think there's goodwill from the government to work with us, but we've waited so long to hear what they're proposing to do with the recommendations, and so our frustration is, well, we thought if you're going to only do that, you could have done that earlier than taking 9 months, to be quite honest. And we also have to not forget that we need to ensure that the state and territory governments are also working with us. So it's a big job. We're not saying it's not a big job, but we want to see it moving along.
Yep.
They can't give us a lot, then take it away from us.
No,
So
that's right. Yeah.
Plain chicken.
Plain chicken. Yeah. Is there anything you want to add, John? David? I would like to, honestly, thank you very much, Ross, for joining us on the show and providing an insight of where we are in terms of the recommendations provided by the DRC. You heard it all from the CEO of himself. Thank you very much for being with us.
Pleasure.
And I look forward to seeing how the recommendation.
Well, we'll keep everyone posted. We're going to keep working on it. Don't worry.
Maybe later on down the track we can have a round table discussion.
That's right, and it's something that we all will be working on, and I'm pretty sure we'll hear
happy to come back anytime
from us. Thank you, everyone, and you've been watching CripChat. You're weekly podcasts on everything disability. Join us next week as we talk about more things disability related. Goodbye for now.